Hi everyone, welcome back to your channel. I love pharmacology, and in this short video series, let us learn about the important aspects of alcohol. So, the aspects of alcohol are very important, and you should know each and every points of this. And each of this has been already asked in your exams, and we have picked up very important points that you can concentrate just before exams. So, welcome to this short session on alcohol. So, first of all, you should remember that alcohol belongs to zero order kinetic, zero order kinetic. So, as the dose increases, it reaches the saturation kinetic. So, what is the name for the other name for zero order kinetic? The other name is saturation kinetics, saturation kinetics, saturation kinetics. So, zero order kinetics, where as the concentration increases, the excretion remains constant. And if you double the dose of the alcohol, the excretion remains constant, but the concentration will go on increasing. So this may lead to harmful adverse effects. So most of the drugs will follow first order kinetic, but not the zero order kinetics. So which is the most common side effect which is seen with the acute alcohol ingestion, acute alcohol ingestion. So you're going to notice hypotension. There will be fall in the blood pressure. The patient will have a features of dizziness, headache, light headed headache, etc. And what happens with respect to the chronic ingestion of the alcohol? So chronic ingestion of the alcohol will lead to a characteristic conditions which will run over a long period of time. And these are, it can lead to hypertension, development of hypertension, and also there can be dilated cardiomyopathy. So there will be compromise with respect to the blood vessel as well as the cardiovascular system. So as it says that hypertension, so the chronic alcohol ingestion can lead to some pathological changes in the blood vessel, especially in the vascular endothelium, leading to the hypertension. And also it will cause dilated cardiomyopathy. It will going to affect the ejection of the blood into the circulation. So please do not confuse. Acute ingestion can cause hypotension, whereas chronic ingestion will cause hypertension. So next, coming to the drug, a very important drug, that is disulfiram. So when do we give disulfiram? Disulfiram is given to withdraw the alcohol in a patient who is chronic alcoholic. Only if the patient is motivated, you need to go with the disulfiram. So what happens if you give a disulfiram in an unmotivated patient? So if you give a disulfiram in an unmotivated patient, it will going to cause disulfiram like reaction. So the patient will experience disulfiram reactions. So this will be very dangerous. The patient may die also. So what are the symptoms of disulfiram reaction? So usually it will lead to headache, headache, tightness in the chest, sweating, chest pain, etc. So this will going to produce a unfavorable environment or unpleasurable feelings, so that the patient will not be able to take alcohol again. So in a disulfiram injected patient, you need to advise him not to consume a alcohol. If he consumes alcohol, it can lead to disulfiram like reaction, and the patient may die also. So what is the other name for disulfiram therapy? It is also called as aversion therapy. Aversion therapy. In aversion therapy, which is a drug which is used therapy. So in aversion therapy, you're going to use disulfiram. So one more question that you can expect in your exam is, what is the mechanism of action of disulfiram, or the which enzyme is inhibited by disulfiram? So disulfiram, you can remember DD. So disulfiram dehydrogenase, aldehyde dehydrogenase. So disulfiram will going to inhibit the aldehyde dehydrogenase activity, aldehyde dehydrogenase activity. Apart from that, a very important thing you should remember is what happens with respect to the enzyme, with respect to the acute alcohol intake and a chronic alcohol intake. So the chronic alcohol intake will lead to enzyme induction. Enzyme induction, this may lead to decrease in the concentration of the other drug. So if there is acute alcohol ingestion, what happens to the enzyme levels? So it will going to inhibit the enzyme activity, and if some other drug is administered along with the alcohol, this will lead to increase in the concentration of the drug. So chronic alcoholism will induce and acute will going to inhibit. So here there will be a decrease in the concentration because of enzyme induction. Here there will be increase in the concentration. So this will lead to decrease in the effect of the drug, and this will lead to increase in the toxicity, increase in the toxicity. So please remember, chronic will induce CI and AE, CI and AE. So next, coming to the, which are all the drugs which are going to produce a disulfiram like reaction. Whenever these drugs are consumed along with the alcohol, it can lead to disulfiram like reactions. Very important, you need to remember this. One is cyclic 4 GMP, cyclic GMP. You can remember it as cyclic GMP. So there are four C's you need to remember. So what are those four C's? One is chlorpropamide, second is cefoperazone, cefomendol, and cefotetan. So this is the anti-diabetic drug chlorpropamide, and cefoperazone, cefomendol, and cefotetan are cephalosporins. And G stands for glycofulvin, and M stands for metronidazole and moxolactam, and P stands for procarbazine. So let us repeat. There are three C's and GMP, cyclic GMP. So four C's stands for chlorpropamide, cefoperazone, cefomendol, cefotetan, and G stands for chrysofulvin, and M stands for metronidazole and moxolactam, and P stands for procarbazine. So please remember in your exams, if the patient is an alcoholic and if it consumes these drug, it can lead to disulfiram like reactions. So next, coming to the drug which will going to decrease the alcohol craving. So this can be remembered in the mnemonic NOTA. So drugs which can decrease the alcohol craving are NOTA. NO stands for naltrexone, O stands for the ondansetron, T stands for topiramate, and A stands for the acamprost. So NOTA, you can remember it as NOTA. N stands for naltrexone, O stands for ondansetron, T stands for topiramate, and the A stands for acamprosate. So what will be the treatment for alcohol dependence? So till now we talked about the drugs which are decreasing the alcohol craving. So these are the drugs which will going to decrease the craving. So especially in case of dependence patient. So benzodiazepines can be used to prevent a withdrawal. You can use the chlordiazepoxide as well as diazepam. So please remember, benzodiazepines are used to prevent the alcohol withdrawal. So usually you use the diazepam or chlordiazepoxide. So naltrexone, which is a opioid receptor antagonist, it is used to decrease the alcohol craving. Whereas acamprosate belongs to NMDA receptor antagonist, which is mainly used for maintenance therapy of alcohol abstinence, maintenance therapy. Whereas again the topiramate and the ondansetron, which is 5-HT3 antagonist, and topiramate, which is an anti-epileptic agent. These two drugs again can be used to decrease the alcohol craving. So till now we saw two drugs for alcohol craving reduction. One is the naltrexone, topiramate, and the ondansetron. Whereas acamprosate will going to used for maintenance therapy, and benzodiazepines are used to prevent the alcohol withdrawal symptoms. And disulfiram, please remember, it is contraindicated if the patient is physically dependent on alcohol. Physically dependent on alcohol. So coming to some of the drug of choices with respect to the methyl alcohol poisoning. So in case of the methyl alcohol poisoning, you can go with the specific drug, that is ethanol. Ethanol can be used to decrease the methyl alcohol reduction or degradation, which can lead to active metabolite, which is also toxic in nature. So this toxic metabolite, like the formic acid or the acetaldehyde, can lead to damage in the retina, and patient may go with the blindness also. So to decrease or to divert the pathway of metabolism, you're going to use the ethanol in case of methyl alcohol poisoning. Apart from that, there is a drug of choice for methyl alcohol poisoning, that is fomepizole. Fomepizole. So fomepizole, what is the mechanism of action? Mechanism of action of fomepizole is it will going to inhibit the alcohol dehydrogenase enzyme. So please do not confuse. So disulfiram was inhibiting aldehyde dehydrogenase, whereas fomepizole will going to inhibit the alcohol dehydrogenase. Along with that, since the methanol will going to cause folic acid deficiency or folic acid deficiency, you need to give a supplementation of folic acid as well as the folinic acid. So whenever we talk about the alcohol, please remember some of the very important point. So you should never forget disulfiram. You should never forget fomepizole. So you should also remember which enzyme is inhibited. It will going to inhibit the aldehyde dehydrogenase, whereas fomepizole will going to inhibit the alcohol dehydrogenase. So acute alcohol ingestion will lead to enzyme inhibition, whereas chronic alcohol ingestion will lead to enzyme induction. And also, whenever there is an acute alcohol ingestion, it will lead to fall in the blood pressure, whereas chronic alcohol ingestion will lead to hypertension, and also dilated cardiomyopathy. And please remember, the alcohol will follow which order of kinetic? It will follow zero order of kinetics. So only in case of motivated patients, you need to give disulfiram. So what are the other drugs which you need to be careful with respect to the disulfiram-like reaction? Like chlorpropamide, that 4Cs, cyclic GMP, you need to remember. Chlorpropamide, cefomendol, cefoteton, cefoperazone, etc. And also you should never forget very, very important drug that has been, every time they are going to ask the patient was a chronic alcoholic, he took a metronidazole. So what will happen to this patient? So patient will go for disulfiram-like reaction. So otherwise they will ask the patient was a chronic alcoholic who experienced disulfiram reaction. What is the suspected or the probable drug? So you need to pick from the table. Is that clear? Okay, fine. Hope you enjoyed this video, and if you have any doubts, please feel free to put a comment in the chat box. And if you like this video, please do subscribe to my channel, I Love Pharmacology, for more updates on pharmacology topics. Thank you.